that good now?
Yes, that's good. How are you going?
Uh, in terms of the knee process, very
Yeah.
well. Um, so if you remember, the reason I came to see you was because I decided to have a knee operation because I didn't have flexion, and you offered me a way to get flexion back, and I've got flexion back at a level that is excellent compared to where I was going. I can ride a bike. Which I couldn't do. I can
Yeah.
walk up and down steps properly, which I couldn't do. I've made an enormous stride. Um, and the only problem I've got, the thing that's holding me back, is that pain in the back of the knee, which has nothing to do with it. I've never been able to diagnose. But it's now the thing that holds back the flexion.
Okay. So the front of the knee is all feeling a lot freer, the front around the kneecap.
Absolutely.
Yeah.
Absolutely.
So when we first saw you, you didn't even have quite 90 degrees of flexion.
No,
And so now what?
I was at 120 degrees last night.
Okay, great. So when we did the last shockwave session last week, we got to 140.
Yeah, and that's something that's important for you, I think, clinically, to get feedback from me that the knee seems to react. I don't know if it's me or whether it'll be a lot of patients. The knee gets a lot of stimulation. There's a lot of energy gets in there, and it takes 5 days a week to come good, to sort of loosen up again. And yesterday and today has been the best the knee's been a week after treatment. But if it's the back of my knee that's doing that, or the whole knee.
Yeah, that's okay. So predominantly with the shockwave, we targeted the patella, so right around that kneecap, and we tried to break up some of that thickening and those adhesions that really didn't allow that patella to glide when we first saw you. So the treatment we've done has been quite aggressive around through the joint space, around the kneecap, all that area. So the big thing I sort of wanted to highlight that was when we started, we had a very swollen knee and you couldn't even really define the shape of your patella. So now that that's all broken up, so we've done 3 solid sessions now. And the actual definition of the patella started to return, which is great. Less fluid collecting around the front of the knee. So it just allows more mobility of that kneecap to glide. And we got quite a big cavitation out of the joint also the last session we did. So that really freed up the joint and really just allowed some good blood flow into there. So although the treatment's aggressive and it does create almost like it does stir up the fluid in the joint, and we do get lots of those cells that break up tissue and lots of oxygen and blood flow into the area. So it can feel like it's been a bit battered after the shockwave. So because we've got when you've got an arthritic joint like the knee, everything becomes very stiff and static, and there's not a lot of movement. So not much fluid moves around, not much blood flow. So if all of a sudden we're pumping all this stuff into the knee, I'm not surprised that you felt like it's been stirred up, and it takes a while to settle, which is why we wouldn't treat you more than once a week for this sort of condition. And unfortunately now, due to the restrictions, we've sort of missed our follow-up this week, but I wanted to touch base just to sort of explain where you're at. But to go from less than 90 in about a month to 140 degrees, that was a significant shift in range of motion and mobility, and being able to ride a bike and being able to do those things you couldn't do. And you're not limping now, and you're walking 18 holes where previously around the golf course you had to use. You were using a cart, is that correct?
Correct. And now I'm doing 3 18-hole golf games a week. And I never
That's excellent.
expected to be able to do that. So, and I feel like there's a lot of improvement to come with a contusion in the back of my knee. For someone who didn't have that, then the possibility of freeing up the patella at the front without the back of the knee causing constriction issues, I'm so excited for the potential of the process. It's frighteningly how common this is, and how little options. I mean, the orthopedic surgeons, to a person, I mean, I must have spoken to 5. No one ever gave me any options to get the patella free.
Focus that the treatment plan for someone like you is regain mobility through that patella, through the front of the knee, break up some of that scarring and thickening that's really restricting and painful to allow that mobility back, and now get you exercising, which you are doing, and making sure that you're making the most of that range. So now we've managed to do that. The next part of the treatment plan would be now to address the back of the knee and keep freeing that up. And the other big part of our treatment plan has been the importance of addressing your ankle and your hip. So because you were limping for such a long time, you stopped making good use of the ankle and the hip. And as a result, although we've used the shockwave to treat the knee, it's important that we've addressed above and below the knee joint as well to maximize the benefit we've provided with the shockwave. So if we didn't, we're taking pressure off the knee by making sure the hip's helping and the ankle's helping, and you know, those joints are actually doing their part to contribute to allow the knee to get into as much flexion and extension as possible. So it wasn't just flexion that you were missing, but you never had full extension either. So the knee wasn't able to fully lock out. So now that you've got full extension as well, we're demanding a lot more from the back of the knee as well by forcing you into a position where it just hasn't been comfortable before. So that, I think that was a really big difference, I think, as well. And, you know, obviously you've been quite compliant with the exercises we've prescribed, and you've been doing those. And the fact that you're walking, you know, 3 rounds of 18 holes a week, that's excellent. Like, you're doing plenty of walking, you know, and keeping the joint moving, keep maximizing the mobility. Because if you did nothing, if we just shockwaved you and you went home and you did nothing at all, the benefits wouldn't last as long and we wouldn't be seeing such great improvement. So it's really important that it doesn't matter who we're treating, that once we're trying to give a joint like an osteoarthritic knee joint more movement, more blood flow, more range of motion, that then those things have to become normal. So you have to incorporate them into your daily life to make sure we don't lose that, because it's foreign to the body because it hasn't been there for a long time. So really key that we keep those exercises up to maximize that benefit. Yeah. So that's really good news. So it's great to get an update from you. I had somebody ring and ask her about her father, who's a 70-year-old gentleman that needs a knee replacement. He's got an osteoarthritic knee, and said they heard about us discussing treatment for an osteoarthritic knee with shockwave. And she was asking, you know, some questions about it, and not that anyone else had told him about this sort of treatment, but she was inquiring and wanted to know if I thought it would help, because he has trouble getting up and down a step. And she was worried about him falling, because if he trips on the step because he doesn't have enough knee flexion, then we've got a whole host of other problems. So I think it's really important that people it's not just pain in the knee that is the problem with an osteoarthritic knee. It's the fact that we've got a joint that we don't have mobility, but the range of motion the knee provides allows us to walk normally, allows us to go up and down a step, so people aren't putting themselves in risk of having a fall. So I think as people get older, that's really why we need to give them and maintain that mobility in the knee.
This is a wild thought, an out there thought. I reckon that you might find that if you treat the patella first for 3 sessions and get freedom back, you might then get compliance for the pain of actually treating the osteoarthritic component of the joint, because it's bloody painful. And I feel that there's a lot of people who the pain they get from the knee itself is not as difficult to manage in their life as the lack of flexion.
Yeah.
which was my case. So I'm going through the pain of the osteoarthritic treatment of the knee as an academic exercise for me to see whether that actually makes the pain more manageable. And I've got to say,
Yeah.
I've been walking 18 holes of golf and not getting the sort of pain that I expected to get. So it's hard for me to know, but just as a thought for you as a part of your treatment protocol, getting the compliance on flexion, I reckon it's half the indication. I reckon getting the flexion back is actually probably more important than managing the pain of the knee in a number of patients. And I think it's a sort of a treatment in and of itself. And then managing the osteoarthritic pain is a treatment for somebody who needs that management.
Yeah. Well, they sort of go together, because a very stiff osteoarthritic knee that's very limited, obviously any mobility is going to be of benefit, because that means more blood flow. So all the cells that are good, that help lubricate the joint, they all come in. So they go hand in hand. The more mobility we get, the less pain we're going to have.
Yeah. Well, I can get all that, but the miracle of the flexion assistance will help with your compliance on the pain of the other, I suspect.
Yes, totally. All right.
As you know, it hurts.
That's right. Yeah. It does hurt, but it's only short term, but the gains are worth it, aren't they?
Oh, look, I'm over the moon. And
so do you feel at this point, if you were feeling like the knee replacement was quite close last time we spoke, when we sort of got together?
Yeah, well, I was going to have a knee replacement. That was the next step I was on, until I heard you mention it. When he said that he couldn't give me flexion, he couldn't guarantee me flexion, I backed off having the knee operation, because what's the point? I wanted the flexion. So I see the knee replacement now as a longer term thing, when if the knee's worn out and the pain of the actual knee itself becomes intractable.
Yeah.
But I don't see that happening I just don't know. I mean, it's a bit of a raffle, you know. There's a lot of people who walk every day on bone knee joints. So I certainly, the biggest thing I see for me in this is I've now got a strategy to get me one knee replacement in my life, not two.
Yeah.
And that's, as you know, is a major medical achievement. And how many people of my generation are going to need 2 and 3 knee replacements? They're even talking about saying the third ones can't be done clinically.
Yeah.
Because the downsides of them are so great.
Yeah. Yeah. But it's not just, I mean, it's also walking, but simple things we do every day that we don't realize how much load we put on the knee, like getting in and out of a car, getting off the couch, getting out of bed. Like all those positions need our knees to be able to bend to help us get in and out and do those simple things that we take for granted when our knees aren't bothering us. Which
are the drivers to get the knee replacement done, because they're the things that make you feel like an old person and make you unable to manage your weight and your movement.
Yeah. And like you said, like you haven't been able to like cut your own toenails or put your own shoes on or do your laces, like all those actions, which again, it's nice to be able to do them yourself and not need help putting your shoes on or not need help to cut your toenails, you know. So it's the little things that people don't realize, the big picture. Although we're talking about, you know, Shockwave for an osteoarthritic knee, essentially you're giving back someone's independence. And that's what's really life-changing about using technology such as this that can like make such a difference in a short period of time.
Yeah.
You know, like in 3 sessions, we've made massive gains.
Yeah.
Yeah.
And I would think I would think you'd need to come back almost annually to have a couple of refresher sessions just to keep
Yeah, well,
the maintenance procedure.
yeah. Well, some people who I've seen with osteo, I see them once a month or once every 6 weeks now. So
Yeah,
they have a top-up treatment, and there's nothing wrong because we have no side effects. There's nothing negative about it.
makes sense.
So yeah, it's no difference to, like, you know, you take your car in for a service, you take your knees in for a service, it's all good.
Absolutely.
Yeah.
Absolutely.
So great to talk to you, Mark. It's been
Pleasure.
really good to catch up and see where you're at.
No problem at all.
Thanks so much, Mark. Bye.
Pleasure. Bye-bye.